Finance Committee will come to order. This morning, the Finance Committee gathers to discuss an emerging trend in Medicare Advantage, marketing middlemen. Now, there's a long history of rip-off artists in the private sector trying to take advantage of seniors who depend on their flagship health program, Medicare. Since I served as the director of the Oregon Gray Panthers, something like a year or two ago, these unethical salespeople would often sell seniors 10 or 15 separate unnecessary Medigap policies that weren't worth the paper they were written on. Senator Daschle, Senator Hines, Senator Dole, and I came in, and we pretty much drained that swamp. The same thing happened at the start of Medicare Advantage. In fact, I think my colleagues were there. Then Chairman Baucus held a hearing on Medicare marketing because scammers were actually going door to door in the South wearing white coats and stethoscopes around their necks to try to persuade seniors to enroll in these plans. We got a few protections, but it wasn't enough. Last fall, I released a report that detailed some of the most outrageous marketing practices I've seen in Medicare Advantage, like vans parked outside senior centers with Medicare splashed across the side and mailers designed to look like IRS documents. Many members of the committee joined Senator Casey and I in calling on the Centers for Medicare and Medicaid Services to make changes to protect beneficiaries from these slimy tactics. CMS moved quickly. Just yesterday, they rejected more than 300 ads because they were just so friggin' outrageous and misleading. At the time, we also said we're not going to take any victory laps. As seniors experience Medicare's annual open enrollment, that started 72 hours ago, our investigators found that marketing middlemen are the latest set of sleazy private sector scoundrels targeting seniors on Medicare Advantage. Now we've got bad actors again gearing up, this time for the new enrollment period. So let's talk about who these people actually are and why they're such a big deal in Medicare Advantage. They are big private marketing companies, and they get in the middle between seniors and their health care coverage. These big marketing companies jump to get in front of seniors, and they especially want to do it during the annual open enrollment period. And what these middlemen are doing is hijacking personal information from as many seniors as possible, and then they funnel the personal information to the health plans that pay these sleazy marketers the most money. Basically, we're going to describe this as a profit for these companies first, help for seniors and taxpayers last. Now, some seniors' information gets passed multiple times from one money-grubbing hand to another. The marketers will sell seniors' data once. If they can, they'll sell it twice. If they can, they'll sell it as many times as possible. The wheel of deceit, friends, just keeps going round and round, ripping off seniors, ripping off taxpayers. The seniors are the ones left getting badgered by phone, targeted on the internet, stuck with mountains of mail, and ultimately a plan that may not meet their needs. To sum it up, the marketing middlemen have made seniors their product, and they are trying to sell as much of the product as they can. Now, it's also taxpayer dollars that is, in effect, lubricating all this. And these dollars line the middlemen's pockets. Insurance experts have told us that marketing costs taxpayers $6 billion in 2022 alone. Put your arms around that. 6 billion taxpayer dollars went to marketing middlemen who may have sold your elderly parents, your grandparents, or your neighbors the wrong plan. It's outrageous, it's a ripoff, it's got to stop. And that's why we've had our investigators launching a further inquiry, because we believe there's additional information with respect to these slimy practices. One other quick issue, and then I want to yield to my friend, Senator Crapo. We're also in a related effort to stop what are called ghost networks. Now, a year and a half ago, nobody knew what a ghost network was. But a ghost network is what it sounds like. Somebody buys a mental health insurance policy, and they expect they're going to get some services. But after they buy it, after the contract is signed, and they actually need it, the ghost network basically has no there. You can't find a doctor. You can't get information about what hours of service they might keep. There's just nothing to follow up on, and certainly nothing resembling the healthcare services you thought you bought. So our investigators looked at a cross-section of mental health plans across the country. They contacted the providers. They asked if they could get an appointment for a family member. They were able to get an appointment 18% of the time. So more than 80% of the time, their plan actually failed them. Even if a senior could make an appointment with provider and get this, they may be exposed to extra costs if they have to go to a provider out of network. In other words, they paid for something, there wasn't any service, they need some health services, they go out of network, and the person they gave the money to originally sticks them with the second bill. So we got a lot of work to do, and I just want to particularly commend my colleagues, Senator Bennett and Senator Tillis. Like Senator Crapo and I and the Finance Committee, we try to be bipartisan. They've introduced a good bill I'm pleased to be a co-sponsor of, try to make sure that seniors will get more accurate data about these services. And we tell some of those ghosts they're fine to run around on Halloween, but they're not going to be able to rip off seniors the way they've been doing. Last point will be this. Over the years, I've come to believe that one of the pieces of the healthcare puzzle that is not getting enough attention is the role of middlemen. Today, we're looking at marketing middlemen. I'm very appreciative that Senator Crapo has joined me in another effort with Senator Stabenow's support and our colleagues here, and that's going after the PBMs, because there again, you have middlemen. In effect, insurance companies taking, big fees, high salaries, rather than getting that money to patients. Now, as Senator Crapo and I have described, these middlemen are not cut from a cookie cutter. They're not all the same. But I think it's important to be looking in the future at this. I intend to do it. We spend $4 trillion a year on healthcare costs, folks, and we can get more value for those $4 trillion. And one of the areas I'm going to be looking at are these middlemen, and I'm very appreciative of Senator Crapo joining me, not just in today's project, but also in the PBM. Senator Crapo.